Rotator cuff integrity tests. Drop arm test instruction to patient. Please relax your arm. I'm going to raise it for you, and then I want you to slowly lower it back down to your side. Procedure. The examiner passively abducts the patient's arm to 90 degrees. The patient is then instructed to slowly lower their arm. Positive sign. The patient is unable to smoothly lower their arm and it drops suddenly, indicating a positive test. Empty can, Jobs. Test instruction. To patient. Please extend your arm out in front of you, with your thumb pointing down, as if you are emptying a can. I'm going to apply some gentle downward pressure, and I want you to resist. Procedure. The patient's arm is abducted to 90 degrees in the scapular plane, with the elbow extended and the thumb pointing down, full internal rotation. The examiner applies downward pressure on the patient's arm. Positive sign, weakness or pain in the supraspinatus muscle. External rotation. Lag sign instruction to patient. Please let your arm relax completely. I am going to position it for you, and when I let go, I want you to try and hold it there. Procedure. The examiner passively abducts the patient's arm to 20 degrees, with the elbow flexed to 90 degrees. The examiner then passively externally rotates the arm to its maximum range and removes support from the wrist while maintaining support at the elbow. Positive sign. The patient's arm lags or falls back into internal rotation, indicating a positive test. Lift-off test instruction to patient. Please place the back of your hand against your lower back. Now I want you to try and lift your hand away from your back. Procedure. The patient is asked to place the dorsum, back of their hand on their lower back. The patient is then instructed to lift their hand away from their back. Positive sign. The patient is unable to lift their hand away from their back, or they can't perform the movement smoothly, suggesting a subscapularis lesion. Belly press test instruction to patient. Please press your hand firmly into your stomach. I'm going to try to pull your hand away, and I want you to hold it there and not let me. Procedure. The patient places their hand on their stomach with the elbow flexed to 90 degrees. The examiner attempts to pull the patient's hand away from the stomach. Positive sign. The patient is unable to keep their hand pressed firmly against their stomach, suggesting subscapularis weakness.